Greene, CEO of the Florida Pain Network, where we connect those in pain with pain relievers throughout the state, including pain clinics, physical therapy practices, and chiropractors. The topic today is epidural injections for spinal stenosis. What are they? How well do they work? Pretty much a frequently asked questions. Well, spinal stenosis affects millions of Americans, and it emanates from good plain old arthritis. So as a person develops arthritis in 30s, 40s, 50s, and up, the joints of the back become arthritic just like any other joint in the body. And the discs, the shock absorbers all the way up and down the spine, can become degenerative and lose height, and that can cause stresses to shift towards the joints more and can cause arthritis. Well, what happens in those joints is two things. One is they start to lose cartilage because the joints are making it just as much as they did before, but they're losing it faster. So it's a ratio problem. That's number one. The second thing is, as a result of that, the body says to itself, okay, I'm not making enough cartilage, this situation is not working. What am I good at? The body's very good at making bone. So it starts to make bone. Do you want that bone? No, because you don't need it. But it makes it anyway. Thinks it's trying to help. So it can develop bone spurs. So along with the bone spurs, it also is good at making soft tissue. So it starts to make more soft tissue to try and help stabilize the area. You don't want or need that either. So all this extra tissue, whether it be bone or soft tissue, it can start to pinch on your nerve roots as they're trying to get out from the spine. Which is why people who have spinal stenosis, they often develop pain in their buttocks, around their hip, down their thighs. It can go down into below the knees as well. It can be a big problem. It can come, it can go, wax and wane, you know. It may stay for months at a time. Well, one of the best treatments for it is epidural steroid injections. Because here's the bottom line with spinal stenosis. It's an elective decision as to what to do with it. You don't have to have surgery for it. It never killed anybody. So one of the things that you can do to prevent the need for surgery is epidural steroid injections. You have pain, the pain doctor injects steroid medicine. It bathes the painful area in a soothing anti-inflammatory, and it brings the pain down. How effective are they? Well, a lot of studies have been done looking at the effectiveness of epidural steroid injections. They've been done since the 1960s. It's not a new phenomenon. I mean, now we have 3 ways of doing the injections. There's intralaminar, there's transforaminal, there's caudal. You know, a pain doctor will pick the one that's most suitable for your situation. But overall, they work about 75 to 85% of the time, good to excellent results. And basically that means that if you ask somebody, okay, you had an epidural steroid injection for stenosis, would you have it done again? And they say, oh yeah, it worked really well. That's a success, okay? Now, it could be a series of injections, meaning you can get one every 1 to 2 weeks, upwards of 3. That's pretty much the standard in the United States. Now, if you get more than that, the theory is that you might be getting too much steroid, and pain doctors tend to shy away from that. So you can have 1 to 2 to 3 injections every few weeks, and then up to 3. And then every few months, the series can be repeated. If the first one kind of works, you can get the second one. It might get rid of the pain, then you stop. You wait a few weeks to a few months, get the third one. Or here a few months, you get a whole new series. Okay? Now, because spinal stenosis is a fixed problem, you have this extra bone, it created a bone spur. Epidural injections are not going to fix that. It's a mechanical issue that's not going to go away. Okay? So it doesn't fix the problem, it puts a big fat Band-Aid on it. And that's fine. If you're 70 and you have spinal stenosis that's symptomatic, you know, and you have the elective decision to make to have an epidural injection that might relieve my pain for 3 to 6 months versus have a surgery that has some risks associated with it, what would you do to make sure that the surgery is really the right thing to do, or that it's even necessary? Okay, so epidural injections definitely have their place in spinal stenosis. They can work extremely well. They may prevent or at least delay the need for needing surgery, and pain doctors are very good at it. All right, so if you need one and you live in Florida, you have some spinal stenosis, back pain, and want to explore your options, go to floridapainnetwork.com, click on I need a pain doctor, and just put your zip code in. That's it. It'll show you the ones closest to you. You can also call us for assistance toll-free at 877-877-8556, and we'll be happy to help you. There's also a contact form on the website. Thank you very much for watching. I'm David Greene, CEO of the Florida Pain Network. The pain stops here.